found in the skin, so there is no allergy to it. It's something that everybody has that. And when it's injected, your body will absorb that, accept that as a normal, natural product under the skin, and gradually starts eating it up. And that's why after a year or 14 months, it disappears, because your body has taken over and chewed up the material and it's gone. But they are safe, and as long as it's done in experienced hand, there's no problem.
No, but that's the key you just touched on. So many times we hear of stories where people go to a mall, for instance, or a salon, and and they have it done. They have Botox injected, or some of the fillers put in from people who aren't qualified, and then you see the horrific results. But when you go to qualified surgeons, doctors such as yourself, then you're talking about gaining all the many benefits that Botox and Juvederm and others have to provide.
Right, as I told you before, for example, Botox, there are specific muscles. The person who's injecting need to know which muscle, what it does, and how to paralyze it, and why you're doing it. It's not just putting some needles here and there and say, okay, the result is there. It's not going to be there.
That's right. Yeah. But then that would apply to anything, actually, when you think about medicine.
Absolutely.
If you go to a doctor for a surgical procedure, if you go to somebody who's qualified, talking about most likely very nice, wonderful results. If you go to somebody who's not qualified, opposite results. So it applies everywhere. You're right. We're now going to meet one of Dr. Hormozi's patients. Welcome, Lynn.
Thank you.
It's great to have you with us. I want to start right off the bat by asking you, what problems were you experiencing with the face that resulted in you coming to Dr. Hormozi?
Well, the first time I came to Dr. Hormozi, my right eye was sagging quite a bit.
Okay.
And the muscle had come away, and so he fixed that and had them, fixed the muscle so that the eyelid came up to match the left eye. And then when I came back to have it checked, I started noticing I was having all these frown lines here, which comes from doing this, which I apparently did a lot.
Sure.
So he put Botox there. It helped to freeze that so it wouldn't create those lines between the brows.
So you just basically came for some facial fillers, and like Botox and Juvederm.
Juvederm is for these lines that we get, the marionette lines here, that we all get from smiling and a little extra skin maybe. And the Juvederm fills it in and once again gives you a little refreshed look.
And how long did these treatments take?
Oh, the Botox took about a minute.
That's it. That's That's not even a lunchtime situation.
The Juvederm, maybe 5 minutes.
That's it?
Yeah. I come in and go back to work.
And how do you feel about the results?
Wonderful. Absolutely wonderful.
You definitely recommend these facial fillers, these treatments to everyone watching?
I would recommend it to anybody that's not feeling really good about the way they look. Okay. It's a very personal decision. But if a woman feels like she's feeling tired or she wants a little bit of a lift, make herself look a little bit better, certainly a few years younger, I would absolutely recommend it.
Well, they're certainly non-invasive. They only take a few minutes, and you look great, Lynn.
Thank you.
Well, on that note, thank you, Lynn, for joining us and being a guest on A New Me.
I thank you.
It was our pleasure.
Thank you.
We're now back with Dr. Hormozi. Lynn was very pleased with the results.
As you noticed, she had made a facelift, but before doing that, she didn't like the frown lines that she had on her face, and she didn't like the nasolabial line, which were pronounced. So in the beginning, that's what she was getting, the Botox and the fillers. And at one point, she decided, I'm going to go that further step and just do a mini facelift. And it's perfectly fine to do that, because a lot of time it's so scary to do a facelift because there's so many bad results that people see. So it's perfectly fine to do step by step, do some of the procedure which is less invasive, but it gives you the result, and people start looking at it and it's like, I like the way it looks. I like the way that there's no, the folds are not obvious anymore, but I don't want to do this every year. Let's do something a little bit more permanent. And then that's when you do the facelift.
And the natural progression that you said would occur. Now, can these treatments that we've been discussing today, doctor, be used on different skin tones?
Absolutely. The Botox has nothing to do with the skin because it's addressing the muscle. Can be done in any color skin, any tone of skin. And fillers, same thing. Again, is injected underneath the skin. Now, somebody who is really prone to have huge hypertrophic scars, I don't recommend to do it. You can do a test to see how they react. And not that the product is doing it, is their own reaction to anything happening to their skin. If there is a doubt, yes, we can do a small test area. If there's no problem, then you can do the injection.
Well, that was certainly very helpful and informative. And on that note, I'd like to thank you, Dr. Hormozi, for joining us again and being a guest on A New Me.
My pleasure.
It was our pleasure. Thank you.